The following segment is sponsored by Northern Nevada Health System.
We're here at the Northern Nevada Health System with Dr. Jane Ohde. She is a doctor of osteopathy. Do I have this correct?
Yes.
Wow, one for one. What is GERD? You specialize in the esophagus and everything else, and GERD can become an issue. What is GERD?
So you might have heard it more commonly referred to as acid reflux. Okay. One of the common misconceptions is that it's too much acid production in the stomach, which is actually not the case. It's a normal amount of acid in the stomach that then flows up into the esophagus.
So what causes it to flow up? Because that's the issue.
Yeah, so your body has two main barriers against this. One is a muscle at the end of the esophagus, and the other is the diaphragm that separates the chest and the abdomen. So it's a failure of one of those pieces of the reflux system.
So how do you treat GERD? In the old days, you'd take a Rolaids or an antacid, right?
And that's still an option, but one of the best first options is to make lifestyle changes. So that can be things like avoiding trigger foods, which can be specific to a person, but oftentimes include all of the good things like caffeine, chocolate.
French fries?
French fries, spicy foods, greasy foods. The other thing is doing smaller, more frequent meal sizes so the stomach doesn't get stretched out, and that increases the pressure in the stomach. And then avoiding eating late at night within a couple hours of laying down.
This might seem like a silly question, but how do you know if you have GERD? Like, how do you diagnose it?
So most of the time, GERD is really diagnosed on symptoms alone, and those classic symptoms are things like heartburn, regurgitation, chest pain. But those can be a bit unreliable because the stomach and esophagus can have other problems going on that can mimic GERD. So the best way to diagnose it is with an endoscopy with a scope, okay, or a special test that looks at the pH levels, the acid levels in the esophagus.
So when it comes to treatment, is it ever something you need to have surgery for, or is it a lifestyle change thing predominantly that can cure it?
So lifestyle changes are a good first step. Sometimes that won't be enough for people, and medication is the next step, which can be things like Rolaids, antacids. Mm-hmm. The most common medication is they're called PPIs, and they reduce the amount of acid in the stomach. But for some people, medications might cause side effects or might not adequately control their symptoms, and in that case, surgery might be needed.
All right. Well, doctor, I really appreciate so much you explaining it, because I think a lot of people are afflicted with it. Appreciate your time discussing it. And for more on GERD and everything else, just go to our website, foxreno.com.